Hello everybody, we are back. A few leftover topics from the Christmas story and holistic healing, but of course the Christmas story never ends, though we are now finding ourselves in a brave new year. So happy new year, and this edition of the Christmas story and the wisdom it offers to the pursuit of holistic healing did begin before Christmas, but I had a lot of presents to open, and it's taken me almost a month to get done with that, and here I am finally. But it turns out to be serendipitous, because along the way of the past month, I had lunch with a friend, and I received some news I wasn't expecting to hear. So this friend is a very dear friend of mine, and she is really, I would say, one of my soul sisters. And she's proceeded to tell me over lunch, "Alexis, there's something I want to tell you. I wanted to tell you before the holidays, but I just couldn't bring myself to do it." She said, "Alexis, I just found out that I have cancer, and it's malignant, and I don't know what stage it's at, but what I do think is really interesting is that I have been feeling for some time that something just wasn't right, and I've been craving foods that I normally don't want, like foods that are anti-inflammatory in nature, and then one day I just had this really deep intuitive feeling that if something wasn't right and I needed to just go and have it checked out. And so I did. And of course there was that moment of recognizing that the prognosis could be one that was very black and white, and maybe it was okay to just close up the books and let medicine take its course. But instead, I found myself coming back repeatedly to this piece of the Christmas story, and just contemplating that wisdom more and more. And I feel arrived at a deeper level of the wisdom that's offered, particularly with intuitive guidance that comes during these times of health challenges. And so I endearingly call this episode of Christmas Story and Holistic Healing, "Saw It in a Dream." And this episode is inspired by specific references in the Christmas story to divine beings appearing, and also divine guidance that was received by individuals such as Joseph and Mary and the three wise men, specifically in the form of dream communication from the divine. Now, I don't know about you, but I myself have always been a lucid dreamer, and when I look back on how dreaming has contributed to my own sense of health and well-being, I remember back to a time when I was 21 and facing a significant health challenge. And what was so poignant about the time preceding the diagnosis was there was a period of about 6 to 8 weeks when I was not dreaming at all, and I felt something must not be right, because I would go to sleep and I just wouldn't dream, and the next night I would go to sleep and I just wouldn't dream. And it turns out that there was a significant health issue going on at that time, and once it was addressed, in addition to the emotional contributors and the physical circumstances of that health crisis, once those things were addressed, my dream life happily resumed. So there are a number of sacred and wise texts that refer to the importance of a life well lived, having an active connection, an active communication with divine sources, which may be expressed in a variety of presentations, including presence of divine beings, including communications with the earth, so on and so forth. And there are a number of contemporary texts which are, thank God, acknowledging the value of that ancient wisdom as it pertains to the emotional, physical, and psychological well-being of individuals in these times. And so for this edition, I have put together some quotes from some sources, and please know that this is an exhaustive topic in that there are just so many interesting pieces of information out there on this topic, but I have selected a few to share with you specifically on the topic of saw it in a dream and wisdom that comes through about health through the landscape of the dream. So here we go. Enjoy. So in the Bible, the Christmas story is told in the book of Matthew during chapters 1 and 2, and you can see highlighted in the following slides a couple of examples where divine intervention is noted as having appeared through dream and prophecy, not only to Joseph, but also to Mary and also to the 3 wise men. And it's even noted that having been warned in a dream not to go back to King Herod, the 3 wise men returned to their country by way of another route. And what's so interesting to me about this story with respect to holistic well-being is that all of these instances of divine intervention were critical to not only the coming of Christ, but also to his survival both as an infant and a young boy. But is divine intervention and or accessing one's higher self a real phenomenon, or is it something that's just written about in fairy tales? Well, the books that follow, the citations that follow in this talk, are all written by well-respected medical professionals whose life work has somehow taken them in the direction of mind-body medicine. So here we have really great crossroad sources on the meeting place between spirituality and evidence-based practice. Body organs are better able to communicate with us at night than when we are awake. Dreams that predict illness, or prodromal dreams, were discussed by scientists as early as the mid-19th century. Cases of strange and prophetic dreams preceded the onset of physical illness abound in the scientific literature. One man, a heavy smoker, had dreams of being back in the army and taking cover during a military action in the hollow of a large tree. As he huddled there, bullets from a machine gun tore into the tree and cut through the lower left side of his chest. Later, he was found to have a small tumor in the lower lobe of his left lung, right where the bullet had hit him. Other cases include that of a young woman who dreamed her stomach burst open after she ate pizza. She ended up with an ulcer. Another woman dreamed that she was lying on the ground when the earth began to give way from a cavity beneath her in which she began to suffocate. 2 months later, she developed tuberculosis, which is characterized by cavity-like lesions in the lungs and difficult breathing. Yet another woman was troubled for more than a year by her dreams that someone was holding a lighted candle to her left leg. She thought she had a mental mental illness and sought out psychiatric help. The psychiatrist listened to her repeatedly describe this dream and sent her to a doctor who ordered an x-ray of the woman's leg. It revealed that she had osteomyelitis, a severe inflammation and infection of the bone in her left leg. How can dreams like this be possible? Studies show that through dreams, the internal organs give us news either that they're not working well or that they're working just fine. Dreams and healing. One of the most common forms of prayer is for healing. If prayer and dreams are related, can dreams heal? Psychologist Sandra Ingerman, who has pioneered a form of therapy called shamanic journeying, describes in her book Welcome Home, Life After Healing, how prayer and dreams can come together for a cure when conventional approaches have failed. For years, she endured a painful problem that medical specialists declared untreatable. Their only advice was that she get used to living with the pain. Desperate for a solution, Ingerman prayed every night before going to bed for help to come in her dream. Nothing happened until months later, when she dreamt one night that she was in her house when suddenly a young, handsome Native American appeared from behind her couch and declared that he had always lived there, only she did not know it. He was dressed in blue jeans and a blue work shirt, and held a rattle made of extraordinary translucent blue skin. He pointed to the place in her body where she experienced her pain, and after telling her she had a problem there, he shook his rattle over the area. At the moment, she felt the pain leave her body and knew even while dreaming that she had experienced a cure. When she awakened, the pain was indeed gone. 10 years hence, it has not returned. From that day forward, Ingerman has turned to her dreams for helping her in resolving both emotional and physical issues. Although the healing dream doesn't always come on the first try, it eventually arrives if she keeps asking. She uses also prayers and dreams as therapeutic intervention with her clients. She frequently prays that a healing dream be sent to them, although never without their consent. Dreams of wholeness. In one of the best books on the subject of lucid dreaming, which are dreams in which the dreamer knows he or she is dreaming, the authors describe several dreams in which the dreamer experienced mystical ideal of unity with the divine. Psychotherapist Ken Kessler had a lucid dream he called the gift of the Magi, in which he was one of the 3 wise men searching for the infant Jesus. As he and his companions are traveling, quote, I enter a state of deep meditation and see so clearly that my ability to see the star is all based on my inner attunement. Without this fine, delicate inner tuning of consciousness, I would not even see the star, nor would care that Christ had been born, much less find him. When Kessler finally reaches the Christ child, he experiences a rush of emotion so intense he begins to cry, and his emotions about the meaning of the journey and finding the child flood him. He kneels on seeing the child, quote, entranced by the dazzling, beautiful light that emanates continuously from his whole body, and especially from his loving eyes that simply look back at me so calmly and steady. I feel as if I could kneel here forever, unquote. The effect lingered. Years later, Kessler feels inspired whenever he thinks of this dream. But you know what's really interesting? In the integrative health model, in the discipline of palliative care, so end-of-life care, the dream life of the patient and all of the soul speak that comes during the final stages of life is something that is revered and honored in the clinical setting. Symbolic dreams. Dreams can be fascinating. People communicate with themselves through dreams, their unconscious minds bringing material to the attention of their conscious selves. In recounting dreams, people also communicate with others. People who develop nearing death awareness know they're not dreaming when they see a place or beings that others cannot. The message is about what dying is like, but dreams may help communicate about the second part of nearing death awareness, what they need to die peacefully. A dying person's dreams may be very important. Pay particular attention to vivid dreams, recurring dreams, or a series of dreams that are progressive in some way. If someone you know who is dying talks about dreams, he may be struggling with something he doesn't understand, but about which he questions or has strong feelings. Encourage him to tell you the details. Listen carefully. Ask him to interpret the dreams, but don't try to interpret them yourself. The most useful response is try to help the person identify the feeling behind the dreams. Dreams that frighten a person may relate to fears about illness or dying. Dreams full of anxiety may mean a person is worried about family, expenses, or arrangements that need to be made. Dreams that are puzzling often indicate a need for information. Very often, simply talking about their dreams helps the dying figure out what it is they are concerned about or need. So, as a soul incarnate, I can't help wondering why, if our sacred texts are openly embracing mysticism, why in cultural practice do we not? Why do we seem to discard that part of our innate wisdom when it comes to making decisions that are eminently influential on our quality of life when it comes to the pursuit of holistic living and holistic health? And friends, I do not mean to imply that on the individual level that decisions are not being made for holistic health. Certainly, there are individuals who are doing that, who are taking upon their own empowerment to make sound health choices for themselves. But in the midst of a health crisis, there are so many opinions that come from outside influences. That certainly can be a challenge to rise above all the socialized imprinting and fear-mongering that exists in the health care industry. So one of the things that I think is so compelling as a physician is that we are, by discipline and by vow, trained to first do no harm. And another principle that is very important as a provider is the concept of providing informed consent to our patients. So when it comes to providing informed consent, as a physician, I keep wondering, how can we be providing these logical recommendations that are completely counterintuitive? They just don't make sense. So it kind of plays out like this. If someone is facing a health challenge which requires their immune system to ramp up and get busy with the natural process of apoptosis, cell-mediated immunity, the body's ability to heal and protect itself from pathogens. And we are making recommendations to destroy the immune system. But at the same time, we are not making recommendations to enhance the immune status. How can we be providing that person with informed consent? But how can we be providing informed consent if we are not open to the dialogue of all of the sources of wisdom that can contribute to the positive outcome of one's health trajectory? Is it possible that we become more inclusive and open to the divine guidance that arrives to us in dreams, in ideas, in intuition? Well, friends, there is good news on this note. In case you don't know, you should know that we seem to be making a move in this direction in the healthcare marketplace. A recent publication by the Mayo Clinic, which was available for purchase in mainstream stores such as Whole Foods, covered a whole issue on natural healing, preventing illness, and improving your life. And this issue covered a number of holistic therapies and discussed what each therapy consisted of, and also covered briefly research that was available on that therapy and the efficacy of each therapy based on the research presented. One key therapy that was noted in this issue was meditation. The term meditation refers to a group of techniques. Many meditation techniques have roots in Eastern religious or spiritual traditions, and some people consider praying a form of meditation. Meditation has been practiced for thousands of years. It originally was meant to help deepen understanding on the sacred aspects of life. In the 21st century, however, meditation has been considerably demystified. No matter how you meditate, the goal is really the same: to focus your attention. You may focus on your breathing as you inhale and exhale, or on a specific word that you've been repeating. Or maybe you meditate by taking a moment of gratitude before you sit down at your desk. The idea behind meditation is to suspend the stream of thoughts that normally occupies your conscious mind. By doing this, meditation can lead you to a state of physical relaxation, mental calmness, and psychological balance. More specifically, practicing meditation can change how you relate to the flow of your emotions and thoughts, and it may help you control how you respond to a challenging situation, including a medical condition. A growing body of scientific research supports the health benefits of meditation. The overall evidence to date supports the use of meditation for a variety of medical conditions, including emotional health, anxiety disorders, asthma, cancer, depression, heart disease, high blood pressure, irritable bowel syndrome, pain, and sleep problems. So I wrap it up with this. How do we, at the individual and community level, fortify our ability to establish centeredness that restores balance, that allows us to draw upon the asset of every tool available to us in the healthcare marketplace, that we become empowered in our decision making as it relates to designing and creating a life well lived. So what do you think? If someone comes to you and says, there's something I want to tell you, I had this dream about, do you believe them? Or do you dismiss it and just say, you don't know what you're talking about. That was just a crazy dream. And what if they said, no, wait, just listen. I had this dream that I had cancer. And in that dream, a voice appeared to me and said, don't worry. I know you're scared, but everything is going to be just fine. And you are going to grow from this process. And on the other side of this health crisis, your life is going to flourish and blossom. So don't worry, everything's going to be okay. What would you do with that if their dream came true? Would you say it didn't really happen because there's no clinical evidence to support that outcome?